the treatment options of entropion and ectropion. The entropion is, we have different types of entropion, so we will have different types of treatment for each of the type. So for the senile entropion, we have procedure like, for example, we have Weiss procedure. In Weiss procedure, what is happening? If this is the eyelid, okay, this is the eyelid, we will split the eyelid into two, we will cut the eyelid and we will pass the everting sutures. So when we pass the everting suture, the lid margin will be moved away from the globe. So this is the Weiss procedure. The second one is the Fox procedure. In Fox procedure, we are excising a triangular portion of the conjunctiva and in underlying tarsus. So the conjunctiva and underlying tarsus, there is the removal or excision of a triangular portion. This is called Fox procedure. The third one is the modified Wheeler operation. And modified Wheeler operation, we are removing a triangular, there is the resection of a triangular portion, but now we will spare the conjunctiva and we will remove a triangular portion of the tarsus and the overlying palpebral portion of the orbicularis oculi. So this is the modified Wheeler operation. Okay. So these were the treatment options for the senile entropion. Now for the cicatricial, as the scar is contracting and the scar is pulling the eyelid margin inward. So for the cicatricial, we will do tarsal hang procedure. Tarsal hang procedure. Okay, tarsal hang procedure. In this procedure, like the Weiss procedure, we will pass the everting sutures. Okay, the everting suture will be passed and the cicatricial part will be moved away from the globe. So this is the tarsal hang procedure. This is the senile entropion treatment. This is the cicatricial. The last one is the spastic. So for the spastic entropion, we know that the spastic is caused by what? By the excessive contraction of the orbicularis oculi. So we have the treatment option, for example, the Botox injection. The botulinum toxin, if we inject the botulinum toxin to the muscle will be paralyzed and the entropion, the spastic entropion will be improved. But in patients which do not respond to Botox toxin, then the treatment option is myomectomy. In myomectomy, we remove the palpebral part of the orbicularis oculi muscle from the patient. So these were the treatment options for the different types of entropion. Now the congenital entropion. In congenital entropion, the treatment option is we will remove the lid margin. Which portion lid margin will be removed from congenital for the treatment of congenital entropion. Okay, so these were the treatment of the entropion. Now for the ectropion, we have different types of treatment for each type of ectropion. So this will become the ectropion. Okay, so for the senile ectropion, if this is mild, we will do a procedure called medial conjunctivoplasty. Medial conjunctivoplasty. In medial conjunctivoplasty, we are removing a diamond piece of conjunctiva from the below the punctal area. For example, this is the punctal area. Okay, so below, if this is the punctal area, this is the punctal area. So we will remove below the punctal area. We will remove a piece of a diamond shaped piece of conjunctiva. Okay, so a diamond shaped piece of conjunctiva will be removed from in medial conjunctivoplasty, and this is indicated in mild case. Another procedure which is called horizontal lid shortening procedure. Horizontal lid shortening procedure. In this procedure, we are excising full thickness eyelid. This is the eyelid. So we are removing a pentagonal structure. A pentagon of full thickness eyelid margin is removed with where the ectropion is most prominent. For example, if this is the ectropion area, so this is the skin. We will remove a pentagon shaped skin. A pentagon shaped skin will be removed from this area. Okay, so pull thickness skin will be removed. A pentagonal pull shaped thickness of skin will be removed from the area where the ectropion is most severe. This is indicated in moderate degree of ectropion. In severe cases of ectropion, we are doing a procedure which is called Kont-Kemonaski procedure. Kont-Kemonaski procedure. In Kont-Kemonaski procedure, we are doing the same thing, like we are removing a full thickness pentagonal piece of the lid margin. But now this will be removed from the lateral part. Okay, the full thickness pentagonal shape will be removed from the lateral part, with plus a triangular skin will be removed. If this is the lateral canthus. Okay, this is the lateral canthal tendon. So lateral to the lateral canthal tendon, also there will be the removal of a triangular piece of the skin. The pentagonal full thickness pentagonal portion, plus from lateral to the lateral canthal tendon, we will also remove a triangular piece of the skin. A triangular piece of the skin will be also removed. So from the lateral third of the lid margin, full piece pentagonal portion will be removed, and lateral to the lateral canthal tendon, we will also remove a piece of skin, a triangular piece of skin. This both processes, these both operations, they are the part of the Kont-Kemonaski procedure. So these are the three operations which we are doing in senile ectropion. And cicatricial, okay, now in cicatricial ectropion, what we are doing, it is the procedure are easy for the cicatricial. In cicatricial ectropion, we are doing a procedure which is called VY operation. VY operation. In VY operation, we are if this is the lid, for example, this is the lid. So we will give incision, as this is the cicatricial ectropion, as we have discussed, when there is any problem with the skin, so it will there will be the scar formation and it will pull the skin outward. So okay, so we will give incision, a V-shaped incision will be given, and that will be undermined, the scar will be removed, and then we will suture the skin in a Y pattern. So this is called VY operation. And the next procedure is Z-plasty. This is done in the in mild cases. In moderate cases, we are doing Z-plasty. In Z-plasty, we are suturing the skin, we are suturing the cicatrized skin, we are incising the skin, and we are suturing it in a Z-shaped pattern. So this is called Z-plasty. Okay, this is in cicatricial ectropion. Now we are left with the paralytic ectropion. Okay, in paralytic ectropion, as the problem is with the facial nerve, so we will watch and wait. We will watch and wait, and if the problem is severe, because there is the problem with the facial nerve, so if, we will wait for the facial nerve to repair and regenerate. But if there is a severe problem, we will do a procedure which is called tarsorrhapy. In tarsorrhapy, we are doing that these eyelids from the lateral sides will be sutured together, and these both upper and lower middle eyelids will be sutured together. So this is called tarsorrhapy. So it will be indicated in severe case of the paralytic ectropion. Okay, so this was about the treatment of different types of ectropion and entropion.